I'm really glad to be able to show you this video, and I hope that as
Little
many
slow
people
speed
as
maneuvers.
possible will see the reaction and behavior of these two bikers.
All right, let's see if this is a good rescue video here. Okay, calling the ambulance. That's good.
Nehyb sa.
The rider's conscious and trying to sit down while the other men are discussing something, so we're taking over. Any unnecessary movement could eventually... Yes. Bones are sharp when they're
Nehyb sa,
broken.
bracho.
Mike starts to ask for any information that might help the professionals upon their arrival. Okay, doing an assessment. Communicates and stays conscious. If they go unconscious, it's fine as long as they're breathing and they have circulation.
Dobre.
If they don't have circulation, they're not going to breathe.
Oddychuj. Buď v kľude.
Leave the helmet on. Can you breathe? Good. So he's right side pain. Okay. He's guarding that right arm in the back. Okay. Right side of the back. So possible ribs.
Jo, nehyb sa.
Possible spinal injuries. Let's take a look.
Nehyb sa, naozaj sa nehyb.
Don't move. Okay. Well, he's going to move because he's in pain, but still, as long as he's laying there, he's fine. Keep the helmet on if he's breathing, talking.
Ľavá noha, OK.
Left leg, right back.
Dobre.
We got some lacerations on the left hand. You can see some, that's a full laceration. That's a full, yeah. You can see some of the tissue underneath. Rider's complaining about feeling too hot and wants to, no, don't.
Počkaj, nemôžeme. Je ti teplo, ja viem, ale musíš vydržať, dobre?
Yep.
Nehyb sa vôbec.
Very good.
Skús.
If you can breathe, keep it on.
Nemôžeme ti dať dole príľbu, naozaj. Pre tvoje dobro, dobre?
Then you start...
Musíš chvíľku vydržať,
I'll talk about it. It's very good. These guys are doing really good when it comes to rescue.
Dobre bude, neboj sa, len ostaň tak, ako si, najlepšie.
Okay, let's see. He's uncomfortable because he's in pain.
No,
there's not much you could do about that.
Vydrž.
It's like, dude, you're gonna be uncomfortable for a while.
No. Vydrž.
How much more do we got? It's hard to breathe. Okay. Yep, the helmet won't go off. Good.
Okay.
Unzip the jacket's fine.
Nemôže sa posadiť.
As long as you're not moving them.
Môžeme ti len podložiť hlavu, Max.
See how careful they're trying to be. That's good. Yeah, they're gonna cut that anyways.
Nehybeme. Len moje... Má ťažko na... Jo.
Now that we have some basic info, what's your name? How old are you? What day is it today? Good. So inability to answer. So if he has that inability to answer these questions, definitely a TBI. If you can't remember your name, how old you are, because your brain's resetting, it's not good. What day it is today? Some days I forget. I sometimes have to look at my phone. But those ones, yeah, definitely. So possible TBI there.
Koľko máš rokov?
These guys have medical training.
Ja. Dobre. Vieš, aký je deň dneska?
Okay, so they're just doing an assessment. What's your name? So he says his name. That's good. That's good. Okay, so let's go back here. I want to point out a few things.
And behavior of these two bikers.
Okay. So if you didn't notice, real quick, we're going to take a look at the bike before the person. So when you're walking up, this is what I do. I'm walking up, I'm seeing the bike, the car, whatever, it's a motor vehicle accident. Seeing the damage to that, because that gives you an idea of what could possibly be happening to the body of that person. So the guy on the left has already called 911, or the ambulance. So here's the thing about rescue, is that first you remain calm. If you notice it says call 911 or tell someone to call 911, because if nobody does, No one's going to get the ambulance. Ensure your own safety. They pulled off to the side. They're double checking traffic. Very good. So we're looking for hazards. That's going to be the big hazard when it comes to being in the roadway is other road users. And then wear PPE, so gloves, so you don't get the hazard of you're ensuring your own safety from any biological issues. So if this person has like hepatitis or very rare, but still you want to have some protection for your mucous membranes, any cuts on your hands. So wearing gloves because you're touching the person. So your eyeballs, you want to keep your visor down in case they start spitting blood. That's not good. You don't want it in your eyes. Same thing with your nose. It'll protect your nose and your mouth. Okay, so right here. Perfect. Look at the bike. So that's a frontal impact. Let's take that off. That's a frontal impact. So he hit something. Now, if you take a look at this vehicle, there's damage to the left side of the vehicle. My idea of what possibly would have happened is that this vehicle is sitting here somewhere, right? Back here, probably, obviously. And then this motorcyclist collided into the back of the side of that vehicle. So when he's saying he has right side pain, right knee, possibly from the impact of that vehicle. So he's going to have that frontal impact stuff. So we're, like I said earlier, we have open book fracture possibilities, hand injuries, and then we're going to have some issues when it comes to that. But when I'm looking at this, because then it gives me an idea of what's happening to this. It also kind of puts you in this mindset of, since you're like kind of, okay, I have a system. It keeps you calm too, because that's part of it, is remaining calm. Because if you're panicking and you're freaking out, you're not thinking of how to stop a major bleed. So don't move. Okay, so he's conscious and trying to sit down, and they're taking over. Okay, so they're handling something else, probably talking to the ambulance. Any unnecessary movement can worsen it. So the fact that he's laying down, the ground itself is a splint. The ground is flat and it's hard, just like if you have a splint on your arm or splint somewhere else. The ground is a splint. So that's keeping his body in line. Yes, he's in the left lateral recumbent position, which is the recovery position. It's not necessarily on the supine position where his back is on the ground. But if he's comfortable here and we're not moving him over back and forth, that's fine. That's okay. Because now it's keeping his spine in basically in a line. So use the ground as a splint. Don't pick him up. Don't sit him down, because now he's like hunched over. Now he's doing this. Now he's doing that. You don't do that. Leave him on the ground. So they're talking about the helmet. Leave the helmet on. It's a full face helmet. The only time you take a full face helmet off is if they stop breathing. If they're breathing, keep it on. You can undo this part, because that can probably be pulling up on them. I get that. Undo the chin strap, but leave the full face helmet on. If they have, unless they're not breathing. If they have a 3/4 helmet or half helmet on, you still leave it on, because you have access to the airway. You leave it on. That's going to help, because when you're on your side, you guys know it. When you're imagine trying to sleep on your side without a pillow. You're doing this, right? Now with the helmet, it's going to push it up a little bit. So it's going to help keep him in line. You might want to pad the space underneath, maybe grab like the piece of debris or his gloves and kind of pat it so he can lay his head down, but it's still in line. Instead of like doing this, it's now the padding keeps it in line. Try that. But yeah, you don't take it off unless they're not breathing. Okay. So he starts to ask for information that might help the fresh. So what they're doing in the medical field and everything, I'd be asking mainly because it's a trauma incident, like where's the pain? So they do say that's very specific. So I always say point where the pain is with one finger. Because when you say where does it hurt, some people will be like right here. Okay, well that's like a big area. So point with one finger where it hurts. Right here. Right there. Right there. That's where it hurts. Okay, now you have a better idea. So if they're like, it hurts on my arm, like they do this. Well, it could be from here to here. Like the injury could be anywhere. So it's like, where does it specifically hurt? Right there. Just right there. So that's good information. But mainly for you guys, let's get this back on screen. They don't have to stay conscious. It's great if they do. Okay, for you guys, the main thing you want to be doing is stopping any major bleeds. Unless you know how to do rescue breathing, unless you know how to do surgery out in the field, unless you have, blood pressure cuff and blood glucose and pulse oximetry and a monitor and everything, you don't. Okay, you don't have that. The only thing you can really do is stop any major bleeds. So asking like medical history, like, hey, what's your medical history? What kind of medications do you take? When was your last oral intake? Like, what did you eat? Did you eat or drink anything last? You know, are you allergic to shellfish? Like, you don't need to ask these questions. You just need to ask and talk to them and try to keep them calm and keep them comfy as best you can, and then search for any major bleeds. So my biggest thing here is that, yeah, okay, cool, he's talking. This guy's talking to him. Me as the camera person, so this is the second rider, what I would be doing is I would first unzip all of this. I would completely unzip this. I would take both my hands and I'd basically grab as high up as I can on his leg. I'm not going to touch his wee-wee, but I'm still going to get close. And I'm going to go down the backside with my fingers with gloves, down the backside of his leg. And I look at my hands. Any blood? No. Cool. Did I feel any deformities? Did I feel like a wetness, or did I feel like some kind of like that's different than a human body? Possible injury there. Then I'm going to go down the other leg. And then I'm going to go down the other, I'm going to go down the arm. And then I'm going to go down the other arm. And since I unzipped everything, I want to check his chest for any chest trauma, any bleeding. Because he had, and we saw how many jackets he has. He could be bleeding on his arm right here, or on his stomach, or on his chest. And it's being absorbed by the 3 or 4 layers of fabric. So you're not going to see any blood just by looking. You have to feel, you have to expose the patient. Now, if you're not comfortable with it, that's perfectly fine. But that's why I always recommend, and we used to sell rescue packs here, get yourself a set of trauma shears. Start cutting this stuff up. Start cutting it up. They're going to do it at the hospital. They're going to do it in the back of the ambulance. They're going to do it because they have to expose and they have to see if there's anything there. So get ahead of it. Now, I know some people are like, oh, it's an expensive jacket. It's this. Insurance will hopefully pay for new gear. Buy new gear. It did its job. It's over. It's done. So time to cut it up. Expose it. And so now you can see if there's any blood. So you can stop any major bleeds, because he could be bleeding out right now externally, and it's something that you can stop. So just the jacket. It doesn't have the back protector. Guys, get yourself a back protector for your jacket. That gray stuff, that gray foamy, squishy stuff that comes with jackets, that's just padding. Okay, get yourself an actual CE level 2 back protector to slide it in.
Oddychuj. Buď v kľude.
And that's another thing. So this guy, when I say have your face shield down and keep your helmet on as a way to have eye protection, nose protection, mouth protection, is that I've had patients, and he's starting to do it, with bloody hands, grabbing things. They'll touch your face. They'll try to do that stuff. I've had to grab somebody's wrist and be like, don't. Keep your hands still. Because they're going to touch you with their bloody hands. And now you're going to get blood in your eye, blood in your nose, blood in your mouth. And especially if he has a TBI, you know, he doesn't know what he's doing. He's just reaching for things. So be careful with that. I don't want blood, someone else's blood in my eye. So right side, specific pain, right side. Okay, remember what we saw the accident, the vehicle? So he hit the right side, possibly. So a lot of people think, oh, my ribs are just right here. No, you ever seen a rib cage? It goes all the way to the spine. So you could have a broken rib back here. And you can feel your ribs. I can't because I have so much muscle. But you can have a broken rib. And there's something called a filial chest segment. So what's happening is that 2 ribs break, and they're basically, every time you breathe, it like does this. And so you're not allowing it's not allowing the lungs to expand, and it's very painful, and it almost feels like you're suffocating. So it's very dangerous. That's a skill that you can learn if you take a bigger class, but it's not something you're going to be able to do out in the field unless you have the equipment.
No.
Possible punctured lung.
Dobre.
Not fun.
Jo, nehyb sa.
Just real quick. I don't know if this is the case, but I always look for random things. So his leg does this, and I get he has a butt, but it does this. Usually the butt doesn't come out to the side. The butt's on the back, right? Whenever I see this little bump, especially right at the intersection of where the femoral head is going inside the hip, I always think that might be a dislocated hip or a broken hip. But the fact that he's able to move, that's a good sign. So
nehyb
I'm
sa
always
naozaj
looking
sa nehyb,
for
postaň tak,
deformities.
ako si.
It could just because of the pocket,
Cíť.
but that's why I touch. I don't just look, I just touch.
Ľavá noha, OK. Dobre.
Because that's another thing is that what you don't realize sometimes, and it's probably his pants, but this is a good example of what a deformity could look like. You see how it just from here, it looks like it's his pants, and it does this. A little bit of an exaggeration. That's what a leg will do with internal bleeding. That's what a leg will do. It will be like normal right here. This is normal. And all of a sudden you see like this little bump somewhere. That's internal bleeding and swelling. I'm not saying that's what's happening here, but I'm just showing you guys an example of what it could look like. Because sometimes that right there will be popping out like right here. And it uses gravity for the most part, so it'd be underneath the leg where it's like this pooling of blood and a little bump. And so there's probably a break in the femur in that aspect, so we'd have to do some other stuff, but I'm just sharing a little bit more.
Dobre.
It's probably just his pants and his butt. So he's feeling too hot and wants to remove his helmet. So no, we're not going to remove the helmet, but I like how they unzip.
Ideš.
Yeah, just keep talking to him. Keep him calm. If you're calm, they stay calm. They might be freaking out, whatever. And they talk about the TBI and asking certain questions. Let's go ahead and take a look at the jacket, though. So all of this can absorb, just even that bottom layer, absorbing blood. Second layer, absorbing blood. Third layer, absorbing blood. Unzip and then cut along the inside of the arms. Not his arm itself, but cut the jacket. Because that's usually where the ventilation is, not the abrasion resistance. That's going to be tough to cut through. Even though these scissors are really good, they'll cut through it. Just cut the inside, and then you can expose, and then you can kind of flap it back over to keep him unexposed after you check his arm. But you're not gonna be able to see any bleeding that you could be stopping if you don't expose the patient.
Áno, nehybeme.
And so he's like, it's hot, it's difficult to breathe. Well, let's do the jacket, not the helmet. That's good. That's a good idea. Good job on
Má
that.
ťažko.
So this is, inability to answer what's your name, how old you are, possible TBI, which they say here. Okay. So what can you do for a TBI? Nothing really. So on the back side of the card, which comes with the rescue booklet, if you want to grab a rescue booklet from the store, it's a more in-depth booklet. It talks about like what you can do. It's a fun little cartoon comic style, like all the different things that you can do. It comes with one of these cards that you can keep in your wallet. So if you're on scene, you're like, oh crap, I don't remember what to do. I'm panicking. Okay, I just need to follow this. I need to follow this. This is the back side of the card right here. And so for head injury symptoms, which is going to be the TBI, these are the symptoms, but really the treatment for any of these things that you can do, just stop any external bleeding, lay them down. They're doing that. Monitor any changes. So if they start bleeding all of a sudden, or they start to, stop breathing, that's a change. And try to keep him warm. He's too hot, so that's perfectly fine. Go ahead and take some of that stuff off. But not much you can do there. It's just something to tell the paramedics that show up. Be like, hey,
Yeah.
he can't answer his questions. He can't answer his name. He doesn't know his name. Like when we first got here, and then they'll ask and they'll say, hey, what's your name? He says the name. It's not that you're wrong. It's like, oh, well, he didn't know earlier, so I don't want to look like an idiot. No, that just means that earlier when his brain was still rebooting, he didn't remember, but now he's trending towards he can remember. And then maybe in the back of the ambulance, when they ask him again in 5 to 10 minutes, they're like, what's your name? He's like, I don't remember. So it's going to go in and out with a TBI. He's going to remember, not remember. The goal is for him to remember at a longer time. So if it's every 5 minutes he remembers, doesn't remember, not good. But then the next time it goes, he remembers, doesn't remember, and it's 10 minutes. Remembers, doesn't remember, it's 15 minutes, 30 minutes, an hour, 2 hours, 3 hours, days. It means he's trending towards his brain is recovering. Now, if he's going from like 30 minutes to 10 minutes to 5 minutes to 2 minutes, and he just straight up can't remember, now he's unconscious, obviously it's getting worse. But yeah, overall, great job by these riders. Excellent work. If I crash, I'd want them on. I want them to take care of me. They did great. So nice little explanation about rescue. But guys, if you like what we're doing here, please check out the store. We have the 2 booklets now. One's pre-order. This one's available right now. Links are in the description. With that said, hope you guys ride safe, be safe, pay attention, don't crash into things. And I'll see you guys on the next live stream.